All right, my name is Choma Joy Omanake. Um, I have so many, bad hospital experience, but I'm going to share just few. Okay, I've gone to the hospital and I met very rude hospital workers. One of the times I took a friend who was in labor to a hospital, and she was in pain, shouting. And the nurse around just came by. Madam, why are you shouting? Madam, why are you shouting? Please don't disturb us here. Am I your problem? Am I your problem? When you were doing it, was it not sweet? And that sounded very rude to me. Honestly, I've not been able to overcome that experience. Then another, I went to a hospital. They kept me for over 15 minutes, and I went to the attendant. Why am I wasting all this time here? Madam, we have not been playing. We are looking for your file. We have not been playing. I'm like, why? I didn't notice whether you were playing, but that's a rude way to respond to matters. And so there are just so many bad experiences. Then another was in line with some ability of the doctors to manage patients effectively. And I had very bad experience. I was to give birth to my baby through cesarean section, and I was given an anesthesia through my vein, and I woke up in the middle of the procedure where I was in pain. The procedure was still on, and they had to tell me, Madam, be calm. We can't give you another injection. You just have to be, you just have to endure this pain. They were seizuring me in pain. And I shouted and I cried all through like a mad dog. And after all, the doctor asked me, I asked you if you do take alcohol, and you said no, but this is the effect of it. You see, this injection weighed off on the way because you have alcohol content in your blood. And I can't even comprehend what this kind of thing is. So there are just too many hospital issues, facing us in the society today. But I think, in all of this, training is one thing, that we really need to put in place for the hospital workers. They really need good training, to handle the patient that come into the hospital. And I think the hospital will even make more money by, training them. Then another is a cost of treatment in the hospital. Well, where the hospital bills you, outbill you, when you finish paying for medical treatment, you won't have nothing to fall back at, to take care of yourself after being discharged. So that is it for now. Thank you.
So some of the things that you have said, as displeasing as they may have sounded, they are the everyday realities in most of the hospitals today in Nigeria. Issues around how that a lot of the staff are not properly trained and so they are rude. Issues around how that some of the people that are employed do not pass through the regimented systems of training in the facility so that they do not know what ought to be done when it should be done. How that the hospital does not concentrate on having a regimented system of billing their patients so that billings are done outrageously. All of these issues totally affect patient's experience. So very quickly, let me jump in on it. The patient who spoke, the staff who spoke rudely to the patient that you actually took to the hospital was one that if there had been proper training and proper compensation management, may have been able to fare better. Yeah, so compensation management in terms of how motivated are some of these hospital staff. When they err, when they do things that are not in accordance with the protocol or the standards of the hospital, are they disciplined? So compensation management must be enforced, must be properly communicated to every staff, regardless of the cadre, regardless of the position. Every staff employed into the hospital, compensation management must be explicitly communicated to them. Then the tariff regime, it must be one that is uniform. It must be one that can be envisaged, one that can be contemplated even by the patient, so that patient can always say, oh, if I walk to hospital XYZ, cesarean section should be about X amount of money. Yeah, myomectomy should be about X amount of money. Ceftriaxone should be about X amount of money. Your compensation management, your tariff regime must be such that speaks to standard that is known to the entirety of the staff and even the patients that you have. Then the last thing that you spoke about, which was the very fact that patient, you, that is, walk to the hospital and the doctor gave you IV anesthesia, and somewhere in between you woke up because the anesthesia had waned and all that. And this speaks also to protocol for procedures. You see, I've worked with a lot of hospitals. I have consulted for a lot of hospitals. And one of the things that I find, very, very annoying is that everybody in the hospital will just do exactly as they feel. No, it is absolutely wrong. You must do exactly as is prescribed by the system. And these prescriptions must be things that were spelled out following after certain scientifically proven facts, so that you can say, before every surgery, the anesthetist must consult the patient, must clerk the patient thoroughly before the patient is wheeled to the theater. If the anesthetist had done this to you, perhaps the anesthetist would have found that you do not take alcohol, or that you take alcohol, and would understand the best route for the anesthesia. Yeah, whether the anesthetist was supposed to do, a spinal anesthesia for you, he would have been able to decide that from clerking you. So, generally, all of these challenges that you just mentioned, let me say this to you. Training, an adequate training and retraining of the staff would have been one thing that can fix it. Great compensation management for the staff would be another thing that can fix it. Then the regimented tariff system would be another thing that can take care of it. Once you can address these three things, you can be sure that all of these challenges plus more would have been taken care of.